Guys, Coach Chuck here with a video on proper breathing as a method of stabilizing your body. This type of breathing is called intra-abdominal pressure, and it's really important whether or not you're in pain or you just want to get more out of your workouts. You want to be able to lift more weight. I've got my shirt off because it's a lot easier to see these things without the shirt on. And this isn't some weird kink, it's the only way I can hold the mic. So, breathing with a proper intra-abdominal breath, we want to be able to breathe into lots of places, but we can think of them as more like quadrants. So we want to have good pelvic floor breathing, so I would need to be able to, when I take a deep breath in, be able to push my fingers out here. Kind of looks weird, you can see that kind of inflated here. Also want to, and a lot of times exhaling is going to be the only way you're really going to be able to fill up all the way, getting a good exhale, but it also puts your ribs in a good position. So I want to also be able to kind of push out here and be able to expand up into rib cage here, and then also, and this one is a hard one for me and for some other people, be able to breathe all the way around. So imagine the body's kind of like a canister, and we want to take the dents out. So if we got dents in there, we want to be able to do them. So for me, the hard part is being able to breathe back here, and so we're thinking about being able to push my fingers out there. So that's the start, that's the inhale, but we have to keep that pressure. So the easiest way to teach that is to take some joints and take some load out of the movement. So we want to get our hips and knees to about 90 degrees. So you might need a chair, ottoman, a table. This box is about right for me. I'm going to show you how to do that, and we're going to talk about the breathing. So want to kind of have pretty much a straight line. Here, and then be able to kind of take some of the load off my low back a little bit here. It should be pretty close to 90 degrees and 90 degrees here. Okay, so then again, thinking about inflating those spots, the easiest way is literally just grip around your belly button, maybe just a little bit lower, you kind of feel all of that. So we're blowing out some candles, and then I want to inhale. And from here, we want to trap that air in there. We want to be able to maintain that pressure after we exhale. So this is where a lot of people miss it. They get it. Okay, nice deep diaphragmatic breath. Okay, that's normal, you know. And then when they exhale, all that tension is gone. And we lose that protective, we lose that safety mechanism for our brain. So from here, we want to think more shallow breathing, and I need to be able to, as I exhale, maintain that pressure, maintain that canister. So even while exhaling, I should still be able to push out into all of these areas. So it's up to you. Get that nice deep breath. Cycle about 10 slow nose breathing breaths from that position. Then you own this position at least. But are we in that position a lot? Not really. So that's just the teaching progression. So from there, we need to be able to get that position in all the positions that we live in regularly. So for seated, that's a lot of us. We need to be able to hold that position seated. So if you're still having kind of trouble with that, and you can't always, put your hands there, I like to use the band as a tool for that. So, and you can also use an adjustable belt. It's going to work really well here. Give me a second. So you're gonna kind of find what areas you're not gonna be able to breathe into as well. But to keep that tension, to keep thinking about that tension, exercise band can be really helpful, kind of right around the belly. And so from here, we want to kind of, tighten this up a little bit as much as we can stand. Again, an adjustable belt is your friend here. This is not designed to be skin on skin contact. So we're inflating and we're feeling where am I having a hard time getting that breath? Again, starting on the ground is a great place to start. But we can look at, okay, let's say I'm having trouble getting that breath to here. You can use a sock, you can use pretty much anything soft. But again, for me, for example, I have trouble breathing into that back. So I want to think about pushing away as I breathe into that back. So I'm cycling those 10 breaths. And this is a skill that we need to train because it carries over into anything else we can do. And you'll find that when you can breathe properly, movement will feel easier for you. So for example, without this breathing, you might be able to control your shoulder to this range, and then that wasn't a trick, that was my maximum range of motion before. And then that pressure gave me some safety so that I can get into a new range of motion. That's vital when we're training. And again, this isn't something that you have to be like, I'm out running, I'm playing tennis, I'm on the golf course. That over bracing kind of actually shuts down some movements. So it doesn't really make sense in a fluid sport. But again, that's why we train, why we exercise, is to get better at whatever it is, even if that's just getting something off the shelf. Practicing that motion, practicing those joint angles with good breathing then carries over so that we don't have to think about it. And our brain can kind of, again, once we get the skill, we'll reflexively get this breathing, especially, if I go to pick up a heavy weight, my brain goes, okay, intra-abdominally breathe, hold some tension, and then tighten up the muscles. So practice this in the positions that you find yourselves in the most often, and practice this in every position that you exercise in. And that's intra-abdominal breathing. Thanks for bearing with me because this is important for you. Okay, so now that we've discussed intra-abdominal breathing and proper positioning, how to set it up, let's talk about what you can do if you feel like you can't really get it in this position. Because some people, immediately as they go to take that breath, their back kind of arches and they're unable to maintain a good core position. So here's a way that we can troubleshoot that a little bit. So I'll show you what that looks like. A good way to check on that is to take a band, towel, sock, whatever, kind of right behind your belly button, low back area. And again, that's partially why we elevate our hips so that we can kind of avoid that. But some people will be here and they'll immediately kind of not be able to maintain. As soon as they breathe in, it'll look like this. They'll breathe in, and their body will immediately pull themselves out of that core. Sometimes that's a lack of good core strength, and sometimes it could be other things. So again, it looks like we're here, and as they breathe in, their body just kind of shifts away. So we may even need to change that a little bit in the kind of developmental sequence here. So you want to get into this position, and as we breathe here, try not to talk too loud for you here, but as we breathe here, we are unable to even get into that arch. So here's where we can kind of feel that pressure. In this position may be a better place to start for you. What happens sometimes is not being in a good position. Again, just the body just tries to get away from that. So that's a good place for you. It can also be great if you tend to feel a little bit of back pain when you lean over. Now, again, this is not designed to treat or diagnose or back pain, but it can get the body used to being in a flexed spine position and restore some of that breathing in that area, make that a little safer for you. Again, all the same strategies we discussed in the other video, that could be a good place to start if you just feel like you can't maintain a good long spine on the ground. One more tweak for those who are having trouble getting into that flex back position, you could put something between your legs, a